Wellness starts in your kitchen. Today, we're diving into a groundbreaking topic in modern health, GLP-1 medication. And I won't be doing this alone. Joining me today are three incredible experts, Dr. Holly Lofton, Dr. Priya Jaisinghani, and researcher and Dr. Melanie Jay. Welcome to Cooking for Wellness, your source for simple, nutritious recipes that support a healthy lifestyle. I'm Chef Jeffrey Held with NYU Langone Health. Today, we're diving into a groundbreaking topic in modern health, GLP-1 medication. And I won't be doing this alone. Joining me today are three incredible experts, Dr. Holly Lofton, Dr. Priya Jaisinghani, and researcher and Dr. Melanie Jay. They will help us understand how GLP-1 medications work, what they mean for your health, and how we can bring those lessons right here into the kitchen.
The way the GLP-1 medications work in the body is that they look just like a hormone we all make called GLP-1. And what that hormone does is it reduces appetite signals from the brain. It makes the stomach empty more slowly, so patients feel full with less and full longer. And it hormonally helps us burn fat more than we would without the medication. And having the right directions of this gut-brain axis is a big part of what helps regulate appetite when taking GLP-1 agonists. It's important that we get a healthy balance of protein, fiber, vitamins, minerals, as well as our hydration so that we can have the best body that we can while we're on GLP-1s. As patients tend to eat less on GLP-1 medications, they also tend to eat less fiber. So it's important to include high fiber foods, such as apples. The fiber is in the outside, so make sure you eat the skin. Raspberries are a very high fiber fruit, so I recommend those as well as other berries because it helps increase fullness as well. And then our legumes have fiber on the outer shell. So if you cook legumes, make sure they're not mashed or pureed, but try to eat them in their whole form to maximize the fiber that you take in. Understanding how the medication works is just the first step. The next question most patients have is, what should I actually be eating? Dr. Jaisinghani sees this every day in her practice.
Because GLP-1s are so effective at regulating our appetite and reducing our caloric intake, we can often miss the fact that we need to focus on our body's nutritional needs. This is very important because within a limited intake, we need to make sure that we're getting the appropriate amounts of protein, fiber, our macronutrients, as well as our micronutrients. So that means within a limited intake, every bite matters. So 3 quick strategies to accomplish your body's nutritional needs include 1. Focusing on nutrient-dense foods. These are foods such as protein and fiber that can be satiating and also help you meet your nutritional goals, including your macronutrients. 2. It's really important to focus on planning out your meals. Having structured meals can help you meet your nutritional goals. 3. To have smaller, more frequent meals in order to avoid any side effects with these medications. It's very important to focus on protein as a core of each of your meals and to keep it at the forefront. Protein is important for your hair, skin, nails, and muscle. The USDA-supported 2025 to 2030 Dietary Guidelines for Americans recommends focusing on protein at every meal with a target intake of 1.2 to 1.6 grams of protein per kilogram of body weight daily. Getting your nutrition right day-to-day is essential. But what does the long-term picture look like? Dr. Melanie Jay's research gets to the heart of that question. It's over to you, Melanie Jay.
Thank you, Priya. So the types of diets that support not only weight loss and weight maintenance, but also improve cardiovascular outcomes and even decrease mortality are diets such as the Mediterranean diet and the DASH diet and other plant-based diets that have been very well studied. A lot of people don't eat enough of lean, healthy proteins. So that's things like fish or salmon, lean chicken. So we want to avoid certain foods. We want to avoid things with a lot of added sugars, such as sweetened beverages or sweets. We want to avoid a lot of processed foods like chips and certain sugary cereals and a lot of other foods that are in packages. Even if they say they're healthy, they're not necessarily healthy if they have a lot of ingredients that you don't understand. A lot of very fatty meats and a lot of butter, those kinds of things can increase the risk of cardiovascular disease. And some popular whole grains include substituting white rice for quinoa or substituting white bread for whole grain bread, and really look at the nutrition label for how much fiber is there, because that's really important. And then having healthy fats and cooking with healthy fats. And in the Mediterranean diet, they use a lot of olive oil, but a lot of people prefer avocado oil or canola oil. Like those are really healthy fats and will be healthier than having too much butter or too much animal meat.
Hearing that makes it clear. What we cook matters. Every ingredient can either work with your health goals or against them. In the next video, I'll show you how to create high protein and fiber-rich meals built to support your body's GLP-1 response. Delicious, balanced dishes that keep you full and feeling great. Thank you for joining me and our experts. Remember, wellness starts in your kitchen. I'm Chef Jeffrey Held, and this is Cooking for Wellness.